So we were noticing in our offices that parents were coming in with children who had growth plate fractures of the top of their shin bone, the tibia, and several of them had asked us if we thought that growth hormone supplementation was associated with this injury, and we didn't know whether it was or not. We searched the literature and there was really no study that looked at this link. For our study, what we did is we looked at a group of patients who had this atypical or rare growth plate fracture at the top of their shin bone, and we compared them to a matched group of patients who had a more typical midshaft tibia fracture. And then we looked back in each of these groups to see which patients were on growth hormone therapy at the time of their injury, and noted that there was a 15 times higher odds of patients who had the growth plate fracture to having been on growth hormone therapy compared to the matched control group. These growth plate fractures at the top of the tibia are very rare and represent less than 5% of tibia fractures in general. Some of the reasons children are given growth hormone therapy would be that they have an underlying medical condition where they have low growth hormone naturally, or sometimes they go on growth hormone therapy more electively to be a taller stature when they're done growing. So next steps from this study, now that we've identified this specific growth plate fracture and the link to growth hormone therapy, is that we're looking at other areas of the body that also have growth plate fractures and seeing if there are similar links perhaps in the upper extremity